Dr. Raajam Murali, Senior Consultant of Infertility at GarbhaGudi IVF Centre, Hanumanthanagar, Bangalore. Today we are going to discuss about age and infertility. As age increases, fertility decreases, and age is the single most important determinant of infertility or fertility in a woman. How does age affect fertility? As age increases, fertility reduces because the number of eggs in a woman decreases as her age increases. The quality of eggs as well as the quantity of eggs decreases with a woman's age. The quantity of eggs decreases as a woman becomes older is because women are born with a limited number of eggs throughout their lifetime. Women are born with 1 to 2 million eggs at birth, and it degenerates, and at about puberty they have 400,000 eggs as an average, and at about 35 years an average of 25,000 eggs will be present, and at menopause women will have 1,000 eggs in her ovaries. So as the age of the women increases, the number of eggs decreases, so is her fertility. The quality of eggs also decreases as the women become older. This is because chromosomal errors in the eggs become more as she becomes older. So as the quality and quantity of eggs decreases with age, it's important to conceive at the right age. So what is called an advanced fertility age according to fertility is it's about 35 years. So it's better to plan a pregnancy before 35 years of age, and after 35 years of age, fertility reduces, so chances of having a natural conception will be lower, and even with fertility treatments like IVF, the success rates are lower as the women become older. Suppose if a woman tries to conceive naturally in her 20s, in her mid-20s, the monthly rate of conception by spontaneous or natural method is about 20% per month. It reduces to about 15% in her mid-30s, and it reduces to about 5% in her mid-40s. So even by natural conception, as they become older, the chances become lesser. In an IVF, if they are less than 35 years of age, the success rates would be around 50%, and if they are above 40 years of age, the success rates reduce to about 15 to 20%. So the success almost becomes half when they become older than 40 years. And women, when they are not planning to have a child in their younger age because of their career or their personal reasons, they want to plan a pregnancy later in life, it's better to preserve their fertility by freezing their eggs. In that way, they can balance their work as well as chance of having a baby later in life. This is done by a process of an IVF in which eggs are grown till they attain maturity, and they are taken out and stored at minus 196 degrees centigrade, and they can be stored for a period of 10 years. At any time they want, they can come back with their partner to make embryos, and that embryos can be transferred into the woman's uterus to make her get pregnant. So this is called social egg freezing. Whenever a woman is not planning to have a pregnancy in her younger age, it's better to preserve her fertility by storing her eggs, and which can be used at a later date for her to get pregnant. Suppose if they have not frozen their eggs, or if they have not had a child when they are young and they want to have a child after 40 years, mostly they may require a donor egg program, which is eggs from a donated woman. A woman will donate her eggs to her, and from the donated eggs they can make embryos with their partner's sperm, and those embryos can be transferred into her uterus to make her get pregnant. When donor eggs are used, the chances of conception will be equivalent to the donor's age of conception. So if the donor's age is less than 30, the pregnancy rates are much better in an IVF cycle when they use donated eggs, and this is usually required in women more than 40 years of age. So it's better to plan a pregnancy before 35 years, and it's better to seek help at the right age to plan your pregnancy. Thank you.